Good afternoon. Oh, that's loud. It's on. Well, welcome. It's so good to see all of you. The group is growing every week. I'm so glad. We're actually getting to do face-to-face things. This is wonderful. Um, Most of you have probably been in on this before, but for the few who might not have, I'll just mention that we try to do this every month. We have 2 resident physicians a month here at Butterfield. And before they leave, they're here for one more week, but before they leave, they give a presentation to you on a hopefully a timely and interesting medical topic to do with aging and health. The great thing I like about it is they make me look really good. And I have no work. I just leave it to them. They do the work. I wanted to bring up a quick topic before we get started into that. This is the time of the year when I'm concerned year-round about dehydration. If you know me, you've heard me preach about this. It is such a common, preventable, but hard problem as we get older. So, including everybody in here, with the exception of these 2, certainly includes me. The thing that I'm going to give you my quick little spiel, and then it's all leading up to the fact that I've got handouts that I want to leave you, because in a newsletter, professional newsletter I got this week, they had a patient handout that I thought was really well done. Hit all the things that I thought were important. So I'll share that, and people can pick them up at the back as you leave if you're interested. But the reason dehydration is such a big issue is that by 70, sometimes by as early as 60, we lose our thirst. And by that I mean it becomes unreliable. It's so diminished that by the time, some of the experts say that by the time a 70-year-old person gets thirsty, they're already dehydrated. So just don't count on your thirst. You know, the first 60 years of life, it doesn't matter, because your thirst is so keen, it'll always cause you to drink enough. After 70, it's just the opposite. If you only drink when you're thirsty, you're going to be a little dehydrated all the time. Now, you can get away with that for a good while, although it robs you of energy. And it does a lot worse than that if something comes along and makes you more dehydrated, like an illness. So I just think it's such an important thing. So what you got to do is know how much to drink. 1.5 quarts to 2 quarts of non-caffeinated, non-alcoholic beverages. It's hard to beat water, but you get electrolytes and other things like Gatorade and things like that. So it doesn't have to be all water. Most people don't find water interesting enough to drink 2 quarts a day, or even 1.5 quarts. So, but it's really, really important. So I'll leave these back here. I think you'll find it interesting, and it's a good reminder. So by the way, if that's a minimum of 1.5 quarts a day, if you're outdoors on a warm day, 80 degrees or more, for every 1.5 hours of activity outdoors on a warm day, you need another quart. So over and above the 1.5 quarts, you need a 2nd quart or a 3rd quart. It's really important. Very, very important. So there's my spiel. That's my preaching for today. I think you probably, if you've heard me talk about the resident doctors that we have here at all, you've probably indulged me in bragging about them. We've been very blessed at UAMS to have, this is our 5th year actually, in this internal medicine residency program. And we have been blessed with some of the best young doctors. I really mean that. I'm not exaggerating. And these are another 2 examples. So Dr. Hasso and Dr. Shaw are 2nd-year residents, and that means that they got their medical degree, their MDs in their case, 2 years ago. They're in their 2nd year of training out of 3 years to be ready to go out into practice on their own. So they're already physicians, but they're in their internal medicine training. So we're blessed to have them. I think you'll recognize their gifts and how lucky we are as they present. Dr. Erica Hasso is a native of California. Where in California? San Diego area. Oceanside, for any vets in here. Listen, I'm very proud she got to Arkansas. Do you know how she got to Arkansas? She's at a recruitment thing for high school students, and she's looking for a college that has field hockey. She's a field hockey player. And she finds Hendrix College in Arkansas. And the more she finds out about it, the more she wants to go to Hendrix, and lucky us. So because she not only went to Hendrix and met her future husband there, but also wound up going to UAMS and ultimately to Northwest Arkansas. And so we're the beneficiary of all that.
I never traced that back to field hockey.
To field hockey, yes. And now they don't even have field hockey at Hendrix anymore, you know. So we had a window and we made it. Dr. Yash Shah is from India. Immigrated with his family to New Jersey from India when you're about 10, yeah. And was in New Jersey all that time except for a brief 9 months over in West Virginia. So he went from one extreme to the other in some ways. And then went to Rutgers University, that outstanding university. I told him I'd been on that campus once. I went and saw Arkansas get defeated by Rutgers in football. So, and then he went to the university in Antigua for medical school. And then we found him and pulled him here. He's got a lot of family in New Jersey, but I told him there's room for all of them here. Just bring him on. We don't want to lose him. We want to keep him. So with that as an introduction, I'll hand it over to Dr. Hasso to tell us about what I imagine many of you are interested in, this new drug that's been out. It's only been out a matter of weeks, and it's already controversial, and they're going to clear the air, clarify everything for us.
Most things. I'm Dr. Hasso. Thank you, Dr. Wright, for the introduction. And this is...
My name is Dr. Shah.
So we're going to talk a little bit about not just Aducanumab, that's the new medication, but some of the other things that are already available and what things that you can do to kind of help with Alzheimer's dementia if you have it, or to look out for it if you are concerned. Okay, so first thing I wanted to talk about just is kind of what Alzheimer's disease is. There are many types of dementia, but Alzheimer's disease is one of those types. It affects your memory, behavior, and thinking. And at the severe stages, it can interfere pretty severely with activities in your day-to-day life. It does affect those activities even in the early stages, but as it gets further along, you might have friends that you notice that this severely impacts day-to-day functioning. And that can be anything from brushing teeth to taking showers, getting dressed. It can be a pretty significant impact on people's lives. So, as I talked about, thank you, there are many types of dementia. We're really just going to cover Alzheimer's dementia today, but it is the most common cause. So 60 to 80% of all dementias are caused by Alzheimer's disease. You can see that there are a couple other ones under there, and they're much less common. Most of them make up about 5 to 10% of dementias, with Alzheimer's making up, like I said, 60 to 80. So it's a pretty significant portion of it. And then some people, of course, have mixed pictures where they have several types of dementia that affects their thinking and day-to-day living. So things to know about Alzheimer's. It's not a normal age-related change. So everyone forgets things, as Dr. Wright likes to say. You know, we all forget. I forget. Dr. Shah forgets. And even people that are 60, 70, 80, 90, and 100 forget. That's not the abnormal part. What makes Alzheimer's different is the way that it affects the day-to-day life activities. The other thing is that it's a progressive disease. Even the medications that we do have, we don't really have anything that's going to stop it from taking its course. It does worsen over time, We can slow it with some of the things that we'll talk about later, but it is a progressive disease that does continually and gradually get worse. And unfortunately, even though we have made some strides in treatment options, there is no cure at this time. And we'll talk more about that later. So just a little brief, not to get super technical into it, but the big change that happens with Alzheimer is the way that the changes that happen to your brain, in essence, it causes the brain to shrink. So you can see a normal, healthy brain on the right side of the screen. I guess it would be your left. That would be what a normal, healthy brain would look like. It's very full, it's very plump. A brain with Alzheimer's disease has shriveled, I guess, significantly, and you can see on the far right that that would be the comparison between those two brains. So just kind of an overview, treatment, management options. So cures, we talked about it, there is none, unfortunately. Possible things that treat the actual disease, there's one, and that's the one that you've heard about that was just approved by the FDA, Aducanumab. Treatments for symptoms, we actually have several. Some of you may be taking them. And recommendations, we have several recommendations to help. There are risk factors that increase your risk of having Alzheimer's dementia, and there are things that can help memory in general that we want people to do regardless of if they have risk factors for dementia. So first I wanted to talk about kind of available treatments. So we've got donepezil, galantamine, rivastigmine, and memantine, and we'll talk a little bit more specifically about each of these. But these are kind of what's available right now to help minimize some of the symptoms of Alzheimer's dementia. And then, of course, we talked about the proposed treatment that actually targets specifically the root cause of the symptoms, and that would be aducanumab. I'm going to let Dr. Shah take over for a little bit and have him tell you a little bit about aducanumab and why everyone is talking about it.
So aducanumab is the first therapy that's approved by FDA since 2003 to treat Alzheimer's disease. Initially, when it came out in the market, it was approved for all patients of Alzheimer's, but last week was narrowed down to patients with mild dementia. The way aducanumab works is it's a monoclonal antibody that works against the amyloid beta, which is fancy way of saying plaques that build up in your brain. So this antibody is there to decrease the plaque. And in theory, if you decrease the plaque, you decrease or you improve the memory. The background on this research, how this drug was approved. So it's an accelerated approval by the FDA. There was 2 different phase 3 trials conducted. One of the trials showed some promise, the other trial did not. So this study, in a way, is not reproducible. The efficacy is lacking. The endpoint of this study, which is decrease in the plaque buildup, will also need to be surveilled in post-marketing with PET scan. And PET scan will be measuring the amyloid beta protein plaques in the brain. It's controversial because in November of 2020, the experts concluded that there's not strong evidence for the drug that it works and it has multiple red flags. In June, fast forward about 7 months, FDA approves it for all Alzheimer patients, but just last week, it's limited and narrowed to only mild dementia Alzheimer's disease. Now, this approval has led to about resignation of 3 advisors of the FDA due to protest of the approval. And now the House committee has opened up an investigation as to why this or how the approval was sort of went. The cost of all of this is also rather prohibitive. some pros, very limited pros for this drug. It's a first FDA approved since 2003. It's also the aim of this approval is to sort of have further research that can help uh, with other discoveries of drugs, and it only benefits about the whole thing is it takes about 4 months of symptom delay. So which means if you're looking for something chronic, this drug is there's not much of a benefit that's shown so far. But there are vast cons of so much that individual. Our slide seems to have been stuck. Yeah. So when it comes to cons, yeah, slight delay. Some of the cons are individual benefits are rather impossible to predict because the way the course of this drug is, the effectiveness is not proven. So there are two different trials were conducted. One showed some promise, one did not, uh, which leads to potential benefits being rather small. And disease will progress no matter what, despite you being on the treatment. So being on the treatment is not a guarantee that the disease will slow down. Uh, with the disease comes the side effects of the drug, and side effects of the drugs were rather concerning. This drug is now only tested in mild dementia patient, and the cost is also rather massive. So the side effects of the drugs, these are some of them. If the slide goes further. There you go. All right. So about 35% of the patients who were enrolled in the clinical studies experienced some sort of a brain swelling, which was seen on an MRI that they used to monitor. Now, with this brain swelling, you have these symptoms such as some nausea, vomiting, but it could lead up to seizures. About 21% of the patients experience some sort of a headache, and about 19% of the patients experience some sort of a microbleeds, which are fancy way of saying microhemorrhage. And 15% of the patients, due to this drug, experience some sort of falls. So it's not an attractive package when it comes to the side effect profile of. And the cost of the drug. So Biogen, the company who's manufacturing Aducanumab, they have put a cost of about $56,000 a year. So if you're on Medicare, you'll be under Tier 5 specialty drug, which means your copay would be about $11,000 a year for a drug that's proven to be not beneficial in certain or most of the patient group. And you will need to be undergoing a PET scan to monitor the plaque buildup, which is beta amyloid. Currently, the PET scan under Medicare is only approved if you have some sort of a cancer to see if how your cancer is spreading. PET scan currently is not approved for monitoring of this drug, so which means it's going to be not covered with your insurance, and you may pay about $2,000 to $10,000 depending where you go. So currently what's happening, so the financial company, the pharmaceutical company, which is Biogen, is required by FDA to perform a new trial sort of a thing to see if it truly improves cognition. And now if that trial shows some failure of efficacy, the FDA will pull the drug approval. So it seems like a live post-marketing research happening on patients instead of patient subjects who voluntarily enroll in those trials. Oh.
Thank you, Dr. Shah. So now, kind of some better medications that have been more established in the world of Alzheimer's dementia. So like we talked about earlier, there was those couple medicines I mentioned. I'll talk about another one as well. There's kind of three categories, two main categories, and then some subcategories of medications that can be used for Alzheimer's dementia. The first main big topic that a lot of people are interested in is kind of the memory, the thinking, those kind of functions. And there are two types of medications that can help with that. And those are cholinesterase inhibitors and glutamate regulators. And we'll talk about what that means. Alzheimer's dementia, like we talked about, can affect a lot of day-to-day functions, and one of those is sleep. And so there's one medication that is approved specifically for patients with Alzheimer's disease to help them with any sleep disturbances they may have. And that medication is an orexin receptor antagonist. So that first category we talked about is cholinesterase inhibitors, and these can help with memory and thinking, language, judgment, and those kinds of symptoms that people start to lose function of with Alzheimer's. There are two medications in this category. One of them is approved for mild to moderate disease, and that one is rivastigmine or Exelon. And then donepezil or Aricept, which is approved for all stages of the disease. The side effects for these two drugs are relatively uncommon, but if you do experience a side effect, usually it's GI upset, nausea, vomiting, decreased appetite, those types of things. And some people do experience increased frequency in bowel movements. Now, in the older population, some people have trouble with decreased bowel movements, so this doesn't always upset people, but it is one of the listed side effects. And then the symptoms of Alzheimer's can all be treated by glutamate receptors, and those also help with memory and attention, language, your ability to reason, and then doing simple tasks day to day. The one medication in this category is memantine or Namenda, and that one's approved for moderate to severe disease. And this one comes with side effects of possible headache, constipation, confusion, and dizziness, and it can be used in conjunction with one of the other medicines as well to treat the two different types of symptoms. And then that last medication is the one that helps with insomnia. It's called suvorexant or Belsomra. And of course, a medication that helps with sleep always comes with the side effects of possibly causing you to have impaired wakefulness, because the point is for it to help you sleep. But it can also be an issue with impaired alertness. So driving is something that can be impaired if that's something that you still do. If you take this medication, it can affect your coordination. If you have depression, it could possibly worsen the depression, and it can cause sleep disturbances where people might have sleepwalking or sleep talking or sleep paralysis on this medication. Did I skip one? Oh, there we go. And then another hot topic is always supplements. We always have people coming into the clinic asking what they can take that will help them with certain things, and you certainly hear about supplements all the time from the internet or from the TV even. And there are some supplements that can be really good, but the biggest caveat to all of that is always that they're not regulated by the FDA. Any supplement you can buy over the counter doesn't have to go through an approval process like the medications that we prescribe. You don't necessarily know if it's safe or effective for what you're trying to use it for, especially if you're buying it off the internet. There's no guarantee that you're purchasing the product that they say they're giving you. Medications that are prescribed have to have a certain amount of active ingredients per the FDA guidelines in order to be prescribed to you, and they have to be what we say they are. Supplements don't necessarily have to follow that. So they might have done a study on X supplement that showed promise for you in a certain type of disease or illness or ailment, but that doesn't mean that what they're giving you actually has that in it. And even though they're over the counter, they can also affect the way your other medications function. So it's always a really good idea to ask your doctor about any of these, because they'll be able to find the resources or know which medications can interact with some of those supplements and which ones are safe to take. with your other medications. So a couple supplements that are marketed for the help of Alzheimer's, but I want to talk about them a little bit because a lot of studies haven't actually shown that they're very effective. One of them being caprylic acid and coconut oil. There's no studies done that show that this is effective. There's actually really no studies on it. So the people that are kind of touting this as a big new cure for Alzheimer's are kind of just taking your money on this one. Oops. Coenzyme Q10, another one that there's no studies that show that it's effective. They have studied a synthetic version of it, and that study didn't show that there was a benefit to it. There are some people that say that it does help, and for the most part it doesn't interact with other medications. So if that's something that you feel strongly about, I'm not telling you to run and throw it out, but just that the studies haven't really shown beneficial data. Ginkgo biloba is another one, and this one was studied and didn't show any difference in the patients that were treated with that versus a placebo pill. Huperzine A, another one that was studied but didn't show a difference. And then omega-3 fatty acids. The data on this one with regard to Alzheimer's disease is still inconclusive, and they need more research to kind of confirm or deny if it's effective. So obviously nothing you can do is 100% for anything, and that goes for Alzheimer's or diabetes or heart disease. Sometimes the genes that we're born here with are what we got, and we got to work with that. We can't change some of those things. And nothing we can do is 100% effective, but there are a lot of things we can do to kind of mitigate our risks with regard to the choices that we make day to day. So non-modifiable things. You can't change your age except about once a year, and it only goes up. So you're kind of stuck with that one. And genetics are just those presents your parents gave you, and you can't really change those, at least not yet. So those are the ones we're stuck with. We also have modifiable risk factors that you can affect. And those include things that you're already doing every day, diet, exercise, anything that helps your health, like not smoking, not drinking excessively, not doing drugs. This doesn't seem like the population of people that's doing a lot of drugs. I don't think you'd be here if you were. Social connection, which is good for all of you here. You have a lot of opportunities to be involved in your community and do things that stimulate, because intellectual activity is also another big one. So 6 ways that have been shown to possibly reduce your risk of Alzheimer's disease is exercising daily. And it doesn't have to be anything crazy, just 20 minutes of walking around the campus, even down the halls. 2 is diet. Mediterranean diet has been one that's been shown in a couple studies to be pretty good for the brain. This diet is rich in produce like fruits and vegetables, legumes, a lot of beans and those types of proteins, fish, because they're really good at reducing inflammation and helping the body and the brain. And then, of course, kicking bad habits. If you smoke, smoking affects your health in so many different ways, including the way that your brain functions. If you drink and you're drinking more than 2 a day, try to cut back. That can help your memory habits as well. Taking your medications for your chronic conditions, minimizing the risks from your high blood pressure, your diabetes, anything else that you may have, keeping on those medications is going to help preserve your memory, or at the very least not make it worse. And then engaging your brain. If you like to do puzzles, if you like to play bridge with your friends here, read books, listen to audiobooks, anything that keeps your brain stimulating, having conversations with people that you live with or live around you, all of those things. I don't know if many of you have heard the phrase, use it or lose it. Your brain's like that. Use your brain every day, and that'll help preserve it. And then, of course, we talked about at the very beginning that dementia can be complicated by Alzheimer's dementia can be complicated by other dementias, and that can include things that happen from having strokes or falls or brain bleeds. So staying safe and making sure that you are aware of, if you have trouble walking, that you use your walker. If you have trouble getting up out of bed, you do it slowly and carefully and try to minimize your risk of falls. Because having to go to the hospital for a bleed because you fell out of bed could make some of these things worse. And then, of course, if you find yourself having symptoms that you think might be showing you that you have possible Alzheimer's, it can be really scary, especially since, after we've talked about all of this, there's not a cure and there's not a good solid treatment that reverses the changes or even slows them. But diagnosis can also be very comforting for some people, knowing kind of what's going on, and if you can name it, then you can tame it, as some people say. It can help you come to terms with symptoms and help you be proactive in what you're going to do and what your plan is for them, and how to get help that you may need. Early diagnosis can help you and your family members make those necessary preparations. So keeping up with your regular family physician is really important. Check in with them. It's okay to ask them if your memory changes are regular, just age or normal person changes, or if there's something more there. Keep up with your family members. Support your family members and your friends. This can be something that would be really scary to go through alone, and a lot of people do kind of pull away. Don't let them pull away. Be there for them. And most importantly, do what you enjoy doing. This diagnosis doesn't have to be something that stops you from walking around and meeting your friends at lunchtime. It doesn't have to stop you from reading the books you love or watching the TV shows or listening to the podcasts that you like. You can still live your life. It doesn't have to change most things about your life immediately. And that's all we've got. Anybody have any questions?
Great. Have a question already? Yes, sir.
You mentioned that there's a new trial underway for that new drug. Do you have any guess on, have they said how long that'll be? I mean, is it a year? Is it 10 years?
That's an excellent question.
Do you know, the original studies they did were 18 months. I imagine it'll be a year to 18 months or something like that. Do you know what happened is it was not going to be approved because one of the studies didn't show efficacy, but the pharmaceutical company successfully appealed that a lot of the people in that study weren't on a full dose. And so they gave them provisional approval with the idea that if the second study doesn't show, they're going to pull it off, which just seems like a terrible pattern, to put something on the market and get everybody excited about it and then likely take it off. So. Other question? Yes.
Is B12 effective and helpful?
I presume you mean for dementia. You want to answer that?
So in and of itself, if you're not vitamin B12 deficient, it's not going to give you some extra added bonus. However, when people start to have issues with their memory, one of the things that we rule out is B12 deficiency, along with thyroid issues, depression, and other things that may actually cause altered memory. And because there's several things that can cause altered memory, we have to rule out and treat all of those things before we kind of go down this, down the Alzheimer's rabbit hole and do all that formal testing. So yes, it can help with memory if the reason your memory is not great is because you're deficient in B12. Does that make sense?
So it's a really good question, and she gave the right answer. B12 deficiency is pretty common. And if a person were having any symptoms that might suggest that, having a level check is a good idea. The main problems it causes when you become low on B12 for some reason is it affects the central nervous system. So the most common thing is peripheral neuropathy. So if someone comes in with unexplained peripheral neuropathy, we always check a B12 among other things. But ultimately, the worst thing that it can do, in addition to balance problems and other central nervous system problems, it can cause dementia. But it's treatable by replacement hormone. Yes, ma'am.
How concerned should we be about forgetting people's names, forgetting the names of things? We joke that it takes 3 Butterfield people to have a conversation because we're each filling in gaps from the other.
You know, you demonstrated the right remedy for it, and that's a sense of humor. You got to keep your sense of humor. I'll answer this one because I think it's so important for everybody to know that one kind of forgetfulness, some forgetfulness we've already acknowledged is normal anyway, right, at any age. But one specific type of memory loss that everybody is going to experience is forgetting names. It happens to everybody. No one gets out without that. The people who are really worried about that are people who've never had trouble with that. Me, I may be getting worse, but I don't notice it because I've never been good with names. But it's the same function that causes you to, right in the middle of the story, not to be able to come up with the word. You know, darn, it ruins the story. But it's the same thing. And that, when that's the only thing going on, you can rest assured that's not early dementia. It's normal aging. And so, yeah, you need a lot of friends who are understanding because they're struggling with the same thing. So, other questions?
I found that I have a terrible time finding my way to places I used to know how to get to. And I think I had a visual memory of how I was doing that. Now I'm puzzled. Is it Fayetteville's growing too fast and no street corners the same anymore? Or is there a logical sequence of place? I don't know.
I like your answer. That's the one I rationalize it for me. I bet they're going to have a better answer, but Dr. Shaw, I can tell you've got an answer.
So, not knowing the ways you previously did, that would be slightly concerning for dementia. However, if it was something new and you knew, let's say, it's a new road and you're trying to get to there for the first time and you forget the next day, that's common. Not knowing your family members' names who you've known for all years, so that would be concerned. So anything that you knew beforehand that you start losing, pay close attention to that.
You know, I think all of us are different and unique, and some of us have, in terms of memory too, have strengths around some aspects of cognitive function and weaknesses around others. On the example you just gave, I'll have to confess out loud that I have always had a problem with, we're on a road trip, we stop at the service station, I walk in the service station, I come out of the service station, and everything is right, left, transposed. I will invariably turn to go back to the interstate to the left when I came from the right. My wife thinks it's hilarious. If I hadn't been this way my whole life, I would be concerned too. But I can't imagine that's going to get better. Hope it doesn't get worse.
And I think to add to that,
anybody else have that problem?
I was going to say too, before I drove myself places, my parents drove me places and we went the same routes all the time everywhere. And when I first started driving, I had no idea where I was going, despite going to those places all the time. Once I started driving, I got my way around. Now, if you're driving less, for example, and now you're just going out every now and then, it would be reasonable that those roads might be a little less familiar as well.
Mm-hmm. Good point. Yes, ma'am.
If you go the road today, then tomorrow it may have a complete do not enter on it. So therefore you're lost again.
Everybody recognizes that. Yes. Dr. Helen.
Thank you. If I may, I want to offer a suggestion. There is a diet that was developed at Tufts University, which is one of the premier universities in terms of nutritional research, and their diet is called the Mind Diet. It's a combination of two well-known diets, one of which is the Mediterranean diet, and I forget the other one, but it's a diet. I know, but I do remember that it is a diet that is designed to protect the heart and circulatory system. Anyway, they say that if a person is on that diet for a considerable amount of time, it is a 54% reduction in the possibility of Alzheimer's. So you may want to look up the Mind Diet. Now, if I can go to a question, one of the unusual, I think, but common symptoms that goes with Alzheimer's is what's referred to as sundowning. Do you know of any physiological reason to explain that?
I hope they do. Listen, everyone should be very reassured about your own memory when Dr. Helen forgets her second diet. I feel better already.
It's the DASH diet. I just Googled it. Or maybe I shouldn't have said that. I should have
DASH
just
diet.
taken credit.
Yeah, but very similar, very similar. So the Mind Diet is very much similar to the two. Okay, great. The Mind Diet that she was talking about from Tufts University is a combination of the Mediterranean diet and the DASH diet. DASH. Other questions? This is fun. This is great. I have two back here. I'm sorry. Oh, sundowning. I'm sorry. I forgot that we had a question.
It's too early for sundowning, Dr. Wright.
Yeah, my pattern is earlier in the day, I
Oh,
guess. Do you have an answer? I don't.
I have an educated guess, and that's, I think, the best that most doctors can offer. I think if we had a better idea of what caused it, we would have better solutions for it. But I think an educated guess is that, with some forms of dementia and not just Alzheimer's, you forget a lot of things that go about your day-to-day life. Like Dr. Wright mentioned earlier, as you get older, your mind forgets to remind you that you're thirsty. There's a lot of other things throughout your day that kind of orient you to what's going on and what comes next. You know that when the sun's about middle of the sky, it's about lunchtime and you're hungry and you go eat. As you get some of these dementias, you're not getting a lot of those cues from your day-to-day life that are telling you those things, and so it's a lot easier to get disoriented, which is why some of the things we do in hospitals when people start sundowning is, stick them very strictly to a schedule. Meals at the same times, lights on and off when it's bedtime and time to be awake. We get people out of bed when it's time to be awake so that they're not sleeping during the day. And a lot of those types of things to kind of help reorient and not have them be quite so confused, if that makes sense.
Yeah, I think with the inability to rely any longer on cognitive logic, other stimulants, environmental stimulants, have a much bigger influence, but that's a simplistic answer. Yes.
Okay, my ultimate question is, how do you diagnose Alzheimer's? Is it a process of elimination?
No, it's slightly better than that. You want to?
Well, we rule out all the things that we can treat, so thyroid disorders, depression, B12 deficiency, like we talked about. And then there are cognitive tests that you can take. If you've ever been to our clinic, sometimes we'll hand you a clock face to draw on for us. And then there's, little quizzes that we have you do, and they get scored, and there are these surveys that have been tested and approved, and depending on the score, it can give us a really good idea of whether or not you have just normal changes, mild cognitive decline, or on the extreme end, like something like Alzheimer's dementia. And then, of course, there are neurologists that specialize in these things who can do much more complicated testing to rule in or rule out those diseases.
In fact, the most definitive test, I mean, people have asked me this for years, should I get a CAT, should she have a CAT scan or an MRI, what's the best? Say, most diagnostic evaluations for dementia don't even require either one of those scans. They're not going to be that helpful in most cases. But the long version of what she's talking about with these, which is a neuropsychological testing, a battery of tests that takes about 2 hours. The ones we do in the clinic take less than 10 minutes. But the 2-hour test is absolutely the most definitive evaluation for possible dementia. It not only tells you, is it dementia, it also tells you with pretty high likelihood which type of dementia it is. Absolutely, especially on the subject of medicines that we're talking about. Those medicines that we've had for 18 years, they really only have approval and an indication, a formal indication for Alzheimer's. They don't help vascular dementia. They don't help Lewy body dementia. In fact, there's some of these that you just wouldn't want to put a person on any of those medicines that could make it worse. So that's a really important thing.
I'd like to return to talking about this new medication that's a monoclonal antibody. And from what I understand, or what you said, was that what they're looking at as an indication that is effective is that it does something about the beta amyloid plaques. Is there any suggestion that the tau protein, which also is involved, is affected by the monoclonal antibody treatment?
Kind of, no.
So you're right. Amyloid and tau proteins are some of the, most of the proteins that are sort of looked and researched for Alzheimer's. In my reading, I didn't come across any mention of tau protein there. They were only mentioning about looking at amyloid beta and measuring them on PET scans and see how the progress was with the administration of Aducanumab.
Right. I think there's still a question back here. Did you have a question? I thought someone had raised their hand. Oh, yeah. Oh, do you have a question?
No, I don't have a question. She was asking about having a sense of humor. She said, and I don't know if you lose that a lot whenever you have dementia.
You have to have a sense of humor.
It's certainly not a strong pattern that's predictable. It varies a lot from patient to patient. The question was whether you lose your sense of humor when you have dementia. I think when you can retain the sense of humor, it makes a big difference in terms of how well a person functions. I think I see that all the time. I might just, in kind of a continuation of that earlier questions about the medicines, do you know the medicines we've had for a while, for 18 years, are the most effective is a category called cholinesterase inhibitors. So that's the Aricept group of medicines. There are 3 different ones. They all work about the same. None of them work substantially better, either by the studies or by our experience in community medicine. And they don't reverse Alzheimer's, unfortunately. Although a fair number of families will say in the first weeks a person's on something like Aricept will say, I see a difference. She seems to be be thinking more clearly. But that usually doesn't last. But you know what very commonly does, and here's the real benefit of someone getting on this, is it, for many people, maybe 70% of people, it slows down the decline much slower. So I would say in my experience that it would be rare to see someone after a diagnosis with Alzheimer's who wasn't invariably worse within a year than they were a year ago. And it's going to be downhill. At least it's noticeable year to year, maybe noticeable faster than that. But on Aricept, it is very common to see a person that not only do they not seem to be declining year to year, but they, even if you put them through testing, their testing is plateaued also. It doesn't get better, but it doesn't get worse at the same rate. And there's only a limited period of time that you have that, but it's not infrequent that that's for like 3 years, which it can make a big difference in terms of caregiving demands and quality of life, for sure, for both the individual and his or her caregiver. So just something, I'll just mention the other medicines up there. Memantine, or Namenda is the brand name. That is the one that I haven't had much use for. I haven't seen benefit from it, honestly. It's really only indicated in the later stages anyway, but I haven't seen a lot of benefit from that. There's a question here.
Is Alzheimer's hereditary?
Does run a little bit in families, although the majority of cases don't have other people in the family who haven't. So, but if you have it, there is a higher likelihood that your immediate family is at risk for it. It's the way is that right? Yeah. Well, it certainly does. It's not something that will predict for sure that, that you're going to have it, but it certainly puts you at a little higher risk. So, great questions. Yes, sir.
I have another question on the new one. You said that the benefit is something like 4 months of symptom delay, and I'm having a hard time getting my head around that. So does that mean that you take this drug and then you take it as they're recommending it, and during the year that you're taking it, you would hope to have 4 months of symptom delay? Is that what that means? I guess what happens the next year when you don't take it? Does it come back, or do you have to take it each year to get is it 4 months cumulative total? That's the max? Just if you could talk a little more about that.
I think it wasn't really clear what I read, but I presume from the way it was written that in that 18-month study that showed some benefit, it took 18 months of taking the medicine to get 4 months improvement in how it was progressing.
Me and Dr. Shaw both started taking that medicine today, and you checked us 18 months from now, and Dr. Shaw didn't take the medicine, and I did take the medicine. At the end of 18 months, Dr. Shaw would be at at the end of 14 months, Dr. Shaw would be at the point that I would be at 18 months. Does that make sense?
Yeah, and all this is based on what the typical pattern would be. Great questions. I've got one way at the back, and then Dr. Helen again. These are great questions.
Is there an age range where people get Alzheimer's, and is there a point where you don't have to worry about it anymore?
Well, do you know Dr. Alzheimer's, the first case he studied and made the diagnosis, the autopsy and all this, was someone in their 40s. And so originally, and in fact, when I was in I'll date myself here, but when I was in medical school, Alzheimer's referred to pre-senile dementia. And later you realized, the majority of people with bona fide Alzheimer's are not younger, they're older. there's not a set age range, but the most disturbing thing in the biggest community study, longitudinal study done to date, this was back 20 years or so ago, but of people over 85 in the community, 47% had detectable signs of Alzheimer's. That's just devastating to hear. I mean, this disease is such a scourge. I mean, it's such an epidemic scourge. I'm glad they're making progress, but I wish I could be more excited about the new drug, but you've heard all the reasons why. Gosh, even if it were a little bit more effective, look at how much it cost. And, people are going to have to pay $5,000 for a PET scan just to monitor it. And that would be, I'm sure, at least every year that you're on it. So it's going to, right now, it would be hard for me. I would probably, if you came to me and you told me your loved one, we had a shared diagnosis and agreed that there was early Alzheimer's, it would be hard for me to recommend this new drug based on what we know right now. I have some enthusiasm about Aricept, and most people tolerate that pretty well, and it's economically not the challenge that this one is, so it would be hard for me to be enthusiastic about this new medicine. I kind of sense, I bet Dr. Helen would know better than me, but that there was a lot of politics around this, and you understand. I mean, the community of families with Alzheimer's are desperate to get a medicine that works. We all are, but it sometimes causes decisions to be rushed, and I don't know. I just hope there's something better along the way. They've been, the first 15 or 20 years of my career, the hue and cry was, we need to put some money into Alzheimer's. They just weren't putting research money into Alzheimer's. For the last 2 to 3 decades, there's been a lot of money put into Alzheimer's, and it's still hitting the wall. I mean, 18 years since we had, between new medicines. That's a long time. Good.
I promise this will be my last question, but I'm really interested in your answer to this one. And that is, I understand that there are several, maybe 3 or 4 different theories as to what causes Alzheimer's. I wonder what your opinion is. What is the best of those theories that would explain what causes Alzheimer's?
I mean, it's tough to pinpoint one cause. It could be injury to your brain, which means there's some stroke that you sustained. You had a bleed. Just aging could do it, because at the end of the day, it's atrophy of your brain, which means shrinkage of your brain. There are other theories, such as some sort of a environment that you're in could do it. But I mean, it's difficult to pinpoint exactly what causes it. We know the proteins that sort of get built up, which is amyloid beta or tau proteins. How does all of that happen? I mean, it could be immunological sometimes, because your body's just not clearing all of that. But it's tough to say. It's tough to pinpoint. It's a rather difficult one. Because if we knew what caused it, we would have some sort of a therapy, some sort of a treatment that would be effective.
I think the most compelling theories are to do with inflammation, that results somehow, the inflammatory process results in these protein deposits in the brain, the tau protein that you mentioned, and the amyloid that cause the characteristic things under a microscope on a biopsy or an autopsy of the brain of someone with dementia, with Alzheimer's, are called plaques and tangles, and they're these deposits of protein called that look like plaques and look like tangles in the brain that probably are the result of chronic inflammation set in motion. I'm not sure, but I bet you know even more than that about it, Helen. This is our immunology researcher. She says she's retired, but I can't tell.
I wish I weren't. Yes, there are several different ideas, and one of which is that a virus infection can promote the inflammation that leads then to these beta protein. One of the things that you have to remember about this is that these are normal proteins that have become disfigured. Their folding is in error, mainly, and that the beta proteins are outside of the cell, and in terms of its deposits, the Tau is inside the cell and causes tangles. And so there's no way of knowing, of course, which of those two things are doing the most damage, whether these things occur as a result of Alzheimer's or whether they're causing Alzheimer's. And one of the things that I remember that I think is fascinating, and that was a study done some years ago with nuns. Nuns, because they live in an environment that's pretty controlled and similar from individual to individual. And so they got this group of nuns to donate their brains at the time of death for study. And what they found was that they had some of the same pathology in the brains of nuns who had no symptoms of dementia or Alzheimer's at all, and compared then to the brains of a few who did. And that just leaves, it's a very mysterious disease. I think inflammation and immunology is going to have a big effect in terms of both determining what causes it, and in turn, of course, what can be used for the treatment.
That was a really great review of that, Helen. You know, there's a gene also that's prominent in Alzheimer's. Yes.
As I understand it, the more direct genetic evidence for Alzheimer's is what occurs or what you have in the way of early onset Alzheimer's. There's a whole number of genes that may be implicated in late onset Alzheimer's.
The one they can test, but they haven't come to a recommendation for being tested, is alpha lipoprotein, APOE, and you can imagine once they decide to test everybody, there was something a couple of years ago, a consensus of the experts in research on Alzheimer's, pointing out that Alzheimer's has its onset 20 years or more before it's expressed in a way that we recognize it. That's a scary thought, but I think every researcher in Alzheimer's agrees on that. And there was a lot of thought among this group that we should be diagnosing people a lot earlier. But of course, without treatment, I'm not sure everybody would want to be diagnosed. And if you've got somebody in your family, do you want to be checked? And if you do want to be checked, do you want your insurance company to know it? It's hard ethical questions around this kind of thing too. Well, yes, sir. Okay. We've run over, but we'll make this the last question.
It won't take too long to answer this, and they threw around some terms about symptoms, and they said sundowners. I've never heard that. Does that mean you can't tell night from day, or what?
Almost. You want to define it? Describe it? Oh, she's trying to give it back to you. You've got the microphone. You keep it.
Sundowning is a term that we use to describe the agitation and confusion that some elderly people get in the afternoon and evening times. So, for example, some people get very confused and upset and kind of lose sight of what's going on only at nighttime, but then will function totally normally from when they wake up until, 5 p.m. And the common story we'll hear just, from people that come with their family members to the hospital or elsewhere will be like, yeah, mom or dad does really great, but 5 o'clock we know that they're going to go a little bit crazy. And then, you just help them reorient it, and then it goes away at night when they go to sleep, and then when they wake up, everything's fine. So it's just called sundowning because it comes on when the sun goes down, generally.
The majority of people who show that pattern of behavior do have some degree of Alzheimer's. Occasionally, that shows up before a person's diagnosed with Alzheimer's. So in which case, they get their full evaluation. But well, you've been such an attentive audience. I so appreciate it. Okay, I'm going to break my rule for this kind lady. The last question.
I have one other question. I know in my family, back when I was much younger, elderly aunts, great aunts, they would say they had a series of little strokes. Was that really Alzheimer's?
I can relate to that. When I came to practice here 42 years ago, the word Alzheimer was never used, but hardening of the arteries was used all the time. And in fact, that would be the most common way to say that somebody had Alzheimer's. And it was 10 years before Alzheimer's became the word that everybody recognized. So I'd say more often than not, it's not that they couldn't have had small strokes. And in fact, the second most common type of dementia after Alzheimer's is vascular dementia. And one of the ways that happens is multiple small strokes. So I can't say that it wasn't small strokes, but that's also what they would call Alzheimer's back then. So thank you for your attention. It's so appreciated. Those handouts, one per person or a couple, I really wish you'd pick those up. This is the season where you want to be careful about hydration. Thank you.